A brief background. Yes, their Genesis system uses electromagnetic components to be able to move the catheter around inside of your heart rather than a doctor directing it up, into your veins through your heart. So that's huge. They have their Genesis system, the giant system, which is fantastic, but that does have to be fit into a hospital room. They have to make a room just for that system, which is great. I mean, they do that for intuitive surgical devices as well. But a lot of hospitals can't just take a whole room and just for one machine, for one procedure, for one device. So they've recently got FDA approval for the Genesis X system, which is mobile, right? So they can
Mobile.
wheel,
Wow.
it's
Okay.
mobile. So they can wheel that in to any existing operating room. And the whole point of this whole ecosystem of products was based around what's called their magic catheter, their RMN catheter, which works seamlessly with all their products. Now they had been using Johnson and Johnson to produce the catheters that work with their systems in the
Uh-huh.
past, but it's a disposable catheter, right? So you're paying Johnson and Johnson for the catheter, you use the catheter, net zero profit from that, right?
Mm.
So we've been waiting and waiting and waiting for this magic catheter to get FDA approval. Maybe me more than anybody, because that connects everything together.
Right.
And it's internal, meaning it's three times revenue, it's disposable. They're making it themselves. They made an acquisition of a catheter company back in June this year. Why? A little known catheter company? I'll tell you why. Because in anticipation of the launch of the Magic. So now they have the distribution, the manufacturing set up. And yesterday it was announced that the Magic catheter has finally been approved,
Wow.
which means it'll be used with all of their technology, the entire ecosystem. Everything fits together now. It's the glue between the blocks. It
They're
really
well
is.
capitalized. There's no secondary offerings coming up
No,
right away.
no, no. And it's funny that you mentioned that because we haven't seen a whole lot of stock price movement, right, since this announcement. And I think that that's institutional investors, the big boys are kind of worrying, okay, now they're gonna have to raise some capital, right, to get this thing moving. Wrong. Wrong. They got $12.5 million in a private equity offering earlier in 2025.
Okay.
Specifically for this reason, they use that money to vamp up production and get ready for this day to come. They're ready. Their cash burn is fine. Their balance sheets, I mean, everything looks beautiful. So no, I would not expect a dilution. I mean, and then guess what? Tomorrow they're going to announce one. But I do not, I don't believe that there's going to be any dilution. I think they're fine with cash. They've been planning this for a long time. They're all set up, ready to go. And finally, we get the approval, FDA approval yesterday. I mean, this is huge.
That's fantastic news. And you know what? I know you're in the catbird seat on this. And if you could figure out a way to get somebody from their C-suite on a call, that would be fantastic.
Yep. Well, I'm reaching out to actually do that.
All right, good. So let's leave it there for now. Brian, thanks for joining us, and we'll look forward to catching up with you again very soon. Take
Sounds
care now.
great.